Welcome to Dr. TSPR show. This is Dr. Tangella Shiva Prasad Reddy alias Dr. TSPR. Namaste, Adab, hello. I think our madam too will understand the way I greet because we greet in all religions across the globe because for us, I'm a doctor into journalism and our guest of today, as was on December 16th, she is none other than Dr. Angelique Coetzee, who is the discoverer of clinical symptoms of the so-called Omicron. Under the aegis of Omicron, how commercially viable the health has become, the commercially viable aspect, health aspect of the entire world. A mild disease, as she told that day, and she said the clinical symptoms are the best ones to understand with, and then only you should go for genome sequencing without troubling anyone, without trying to again get people into that fear psychosis. She said no RT-PCR and whatever it is rapid, but it should be genome sequencing because she happens to be the chairperson of SAMA, South African Medical Association too, with so much of responsibility on her shoulders. She was trying to be very clear. She said stop politics because it is human lives which really matter. Pandemic extending into happily the second anniversary, I still don't understand. For a disease which they themselves claim, while World Health Organization, all those CDC or FDA, leave alone 99.9% recover on their own. That is why, without any treatment, that is why the quarantine aspect. Trace, test, and quarantine. So the health, quarantine. Happy life, quarantine. Livelihoods, quarantine. What is there now? The fear, eternal fear. Now people started to revolt in a big way across the globe, though the mainstream media doesn't put it across. We will try to show some visuals. For that reason, I have been trailing her in spite of her hectic schedule. She has consented to be part of this live show. Many thanks to you, madam. 4 word we call. 2 or 3 words before I try to show them whatever statistics you have sent me, how it has come down in the country where these symptoms were discovered. And I do not understand how it is flaring up in other countries worldwide. That beats my intelligence as a doctor and as a journalist, as a concerned citizen.
Good afternoon from South Africa, and I'm very honored to be here again on Dr. Siva's program. And I think it's always important to get the message out there and to try to be as practical as possible and to try to alleviate fears. Please don't get us wrong. Any viral infection can be, in the end of the day, severe. It depends on age, it depends on your immune system, it depends on how many other diseases you have. So there's no viral infection that can never be not lead to death in a person. But if you understand viral infections and you understand how to start to live with the virus and know the simplicity of the treatment most of the times, or the practical methods that you need to take, I think that would bring us much further than to tell each and everyone, it's a very scary virus. I sometimes use the example of we go into a war. The war is the COVID or the Corona family. The government are giving us some guns. The guns are the vaccines, and then they tell us to go and hide. So we then want to know, but what is this enemy? Every time everyone is telling us this is an extremely dangerous enemy. Just go and hide. It's dangerous. So I would like to know, if I am, in such a battle or war, I would like to know, how is my enemy? Who is my enemy? How does my enemy look? What can I do to outmaneuver my enemy. It's not enough to just give me a gun or a jab and tell me to go and isolate or go and stay, in hiding while I don't even know what I'm fighting. So the important thing about this is you need to explain the whole time to all the people out there what is the enemy, what is the virus, how does the virus look, if I get it, not the scientific way of the virus, because the ordinary person out there, 30 mutations on whatever RMD platform doesn't make sense to the average person out there. For me, it's extremely interesting, and I love to hear that part. But for the average person out there, they want to know how does the enemy look like? What should I do when I encounter the enemy? How should I use my gun? What else can I use? Because my gun might not be enough for my, to help me out of this. And I think if we can get this right, we don't need to fear the enemy that's out there. I find it very interesting nowadays observing the hype around the positivity rate. We have said right from the beginning that Omicron might be as fast spreading or even faster than Delta. We have said that. So we said it is a fast spreading variant out there. We said right from the beginning, especially in the first 2 weeks after we have seen the clinical symptoms, we told the people it's mild. For the average person out there, for 99% of the community, it would be mild. Yes, there will be severe diseases out there. But please, if you think you have the symptoms of Omicron, come and get tested. So what we are now seeing, especially in the first world countries, everyone is testing, which is the right thing. We ask them to test. But now, and this is what I can't understand, the moment when the sensitivity rate goes up or the cases are extremely high, that's positive, everyone are up in arms about it. I say, no, you should be happy. You should be glad, because now at least you know what the infectivity rate is in your community. You know that you can take these groups of people, these high numbers, you can ask them to isolate for 7 days. You can assist them with medication instead of, again, giving fear on the high numbers. So would you rather than not having people tested and walking around in the community and infect everyone? Would that be better? Because then you will have lower numbers, and then you would wonder where your death rate is coming from. Or would you embrace and accept the high positivity rate? But rather look at what is your daily death rate attributed solely to COVID-19 cases. How many people are lying in your ICU with COVID? Not people in a motor car accident then tested positive for Omicron. You want to have the granular detail, and we don't get that detail. So if we can get that detail, we can make very informed choices. And yes, it is true that the majority of people in ICU will be unvaccinated with severe disease. But on the mild side, we have seen that it's 50-50, whether you're vaccinated or not. So you have to accept that the vaccines are not the only thing that you need to use. You need to wear your masks, common sense, the simple measurements, as well as staying away from crowds. I hope this helps a bit.
This helps a bit, really, because let me show the statistics which you have sent. First, let me show it to the world, and then I'll definitely, it really helps. You are very pragmatic, very practical to the core. That is really appealing. That's how we want you to be on the show time and again. Here it is, what you have sent me. I'm trying to present. Yeah, this is the present status of today, right, madam?
Yeah.
Yeah.
That was the 5th.
Yeah. In South Africa, this is what is seen today, as shared by Dr. Angelique Coetzee, New cases you have, active cases, total cases, new deaths, total recoveries, tests in last 24 hours, total test positivity rate. As she was slyly putting it out, that this is a highly infectious strain, nothing to worry. And as she said, as infectious it is, it may really help you to develop that natural infection once the exposure happens, like common cold. If I'm not wrong, that's what she was trying to mean. No fear, please. That's what she said. And this is what she shared with me, the 7-day moving average number of new cases by province. 7-day average today, which is lower than yesterday. See, this is how the steep fall, sudden rise, steep fall, almost negligible deaths. This is how, right, madam? Your comments on this?
Yeah. Yes, no, it's right. If you can look at the graph, you can also see the third wave much higher. So remember what I've said, right? Also in the beginning, I've said that when we encountered Delta, Omicron, I said that it might be as fast spreading or even more faster than Delta. If you look at the curve there, it is not as, it's fast spreading, giving you a lot of infections at one time. But I still think Delta was worse. If you look at that graph, and if you look at the narrow angle of this graph, this is a virus infection that will spread like wildfire. In fact, especially families, but just as sharply as it increases, it just leaves. So I've been asked many times now, why is that happening? For me, I think that's the nature of the virus. Because we haven't done anything spectacular in South Africa to get that lower curve there, or to get the numbers lower. I think it's part of this is the nature of the virus itself, and that seems to be difficult for people to understand. But you can see there steep increase, but not as steep as it was with Delta. And a lot of the first world countries, especially in Europe, are still having Delta as well. So Omicron will replace Delta, and then hopefully their numbers will come down.
That's a big news coming from the discoverer of Omicron. She has very clearly stated the highest peak, but not as high, as deadly as Delta variant. And similarly, she clearly states that it has come down because that is the natural way of the virus fading out. That is how it has come down on its own. So why are you fearing? And she clearly states Europe or US for that matter, they are reeling under Delta. That is why the obvious numbers are very high. And the death rate because of the old age and obesity factors and natural immunity factors and failure of vaccine also we have seen. In Israel also, it's a big case study. First dose, second dose, third dose, fourth dose, they are fed up now. Now they are trying to see to that the natural immunity is the best source. They are pondering over it. So any chemical into the body without testing a trial is going to create havoc. That's what we have been stating. Treatment or prevention should not be more harmful and dangerous than the original disease itself. So here are the figures. As she clearly states, Europe reeling under, maybe parts of US, under the Delta, but sooner it will be replaced by Omicron and it will give a big relief, because South Africa is almost back with normalcy there as the steep increase, but not like Delta. No more hospitalizations, not that fatal when it comes to the death as cases in ICU. Here in India, let me show her. All of a sudden they say 10,000, 20,000 today. So many tests. We are asking which panchayat, which mandal, I mean to say which province, in a province, which area, which hospital. I said, reel out the names. All of a sudden lakhs of cases. How can that happen in India? Whom are you testing? See, these are the figures media is trying to highlight and fear psychosis created. Dr. Angelique Coetzee, this is how they are reporting. See, at least here you have very clear. Private, how many? Public, how many? Total. admissions to date. There, vaguely it is being done. How do you look at this scenario of creating fear psychosis by the media? They are trying to do all this media. How do you look at this? Has it become more commercialized now?
It's very interesting. If you look again at that stats there, that 8,887 across 666 hospitals.
Wow.
It's important also to notice that everyone, as in other countries, if you are positive, regardless whether you have been admitted for Omicron or whether you have been in a motor vehicle accident or come in with an appendicitis or whatever, you will then be under stats of COVID. So a lot of that the people there is not primarily admitted for COVID. And I think again, if we look at the data is not good. We tend to give a broad overview, and I think if we really want to know, you have to get the granular data, of that 8,800. How many was really in for Omicron? How many are really, that sick? So if I also look at this another site that we use with the National Department of Health, and in that site, if I can give you the currently, that was yesterday's as well, currently people that's on ventilators, again across 666, is only 304 people, and the previous day it was 309 that was ventilated. So there's 5 less people ventilated, but again, 300 people ventilated out of 600 hospitals, 600 plus hospitals, still with 8,000 people in the hospital. It's not a lot.
It's not a lot, and that too, they have to be properly pruned so that they can be identified under Omicron by further tests. They might have had some other comorbidities, chance they got admitted. So she clearly states such 600 hospitals across South Africa, only 8,887 cases. And in that also, how many Omicron and how many are seriously sick? That really matters. That is a big news from South Africa, from Dr. Angelique Coetzee. This is how the science has to be understood. So number of cases, you create panic. So many tests, you create panic. But underlying, which are the diseases with which people are really getting admitted and being treated for? And as a doctor, even like Dr. Angelique, we wish that everyone survives with a better health. But unfortunately, those who die, where is the postmortem? Where is the postmortem report, and how do you identify these deaths with corona or of corona? That's what she's trying to put it across right from the beginning. How can you? Then how can you? Why are you creating this panic? This is what she's trying to. Am I right, madam?
Yeah. So again, we need to ask the right question. So you can get any answer, depends on what question you ask.
Yep.
And for me, the right questions is look at the death rate, look at your ICU rate.
Yeah.
Not worry too much about the positivity rate. Yes, it's important, the positivity rate. But I've now been told that the positivity rate is important because it will tell you whether the hospitals will be overwhelmed. And then we said, but where's your ICU, especially in the Europe? And then they can't give us really how many ICU cases are there, but they will tell us that the personnel are sick. Now let me tell you, South African experience of healthcare personnel, the nurses and the staff in hospital, what we have seen during Delta was not that the nursing staff has been so much infected by the patients, but when they have tea breaks or lunch, they forget to wear their masks and that social distancing. So most of them were then infected during that time, and not so much because of the patient. So I would always say for any healthcare institution, please double check your protocols when your staff are not working with patients. Are they still following protocols? So, but again, if your staff are highly vaccinated, as we see in the first world countries, then we know that the disease symptoms is more or less 5 to 7 days. So it means a week, then your personnel should be back at work. So not always understanding how other people think. Maybe we think different. Maybe that's the problem.
That's not the problem. See here, decreased severity of disease during the first global Omicron variant COVID-19 outbreak in a large hospital in Shane, South Africa. Because she's just given these figures to say that this Omicron is not that deadly dangerous as the other variants were. And don't panic. Don't create that fear psychosis. That is what she is trying to convey the message to the world. At least now, the better sense will prevail in India, in all states. I hope Honorable Chief Ministers and Honorable Prime Minister will take cognizance of these facts, the facts from the birthplace of Omicron, and then they will understand. That is how they will try to advise their administrators and their fellow supporting media. Otherwise, they are creating panic. That is why she is very categorical and clear, and she is also the chairperson of South Africa Medical Association too. She is trying to present everything in data. This is science and logic. At least I hope better sense will prevail in India. Don't get carried away. Don't create confusion. Kindly don't create that fear amongst people. You have seen what it has done when you created this panic, this fear unnecessarily during second or the Delta variant wave. Unnecessarily people were getting admitted out of fear psychosis, and those who really needed hospitalization or beds, they were out dying. And many people spent lakhs and they lost their lives. And I don't think world over, even World Health Organization has done any scientific study regarding that. Why did so many people who were admitted into the hospital, spending lakhs of hard-earned money, died? Is there anything? Was it drug trial or something else? They have not come out with any data till today. But they now and then they come and try to create this fear psychosis. That is why we are trying to get you out of that. She is very categorical and clear in stating that you need not fear. This Omicron will be a very good happening for Europe also. They will overcome Delta, and this Omicron will give them much needed immunity. It is like a natural immunity booster. You don't need another jab. Omicron is enough. Am I right, madam?
That's it is I think because of the mildness of the symptoms for the average person out there, half of the population would be infected without even knowing, or a lot of people will be infected without knowing, even because they will have maybe a headache for a day and didn't even think about it. And so you will have your immune system and antibodies then developing, and we are hoping that your T cell and your memory cells will remember, even though it was a mild disease, that next time when there's a new variant coming, that you can recall your memory cells and start to fight again.
Wonderful. She clearly states that this disease will help your memory immune cells to remember it, so that in future if something is coming, this will act as a barrier, natural booster. So you should welcome Omicron. Don't panic. See, madam, humanity's whistleblower Dr. Robert Malone sounds the alarm, and his Twitter hand is blocked. How do you react to these type of unnatural things happening in the world? When people question, they try to ban their official tools. How do you look at this scenario? He says a man who died with serious gunshot wounds. This I am going to present. Whistleblower Dr. Robert Malone sounds the alarm, and he is a vaccine researcher. He says, I am mystified how vaccines are being used without any proper safety, efficacy, immunogenicity or peer review trials. They're just pushing, and that too for a disease which has got 99.9% recovery without any treatment. How do you look at this scenario, madam? How can they suppress the voice? Don't you think this is nothing but imposition, as you rightly came in the beginning? All those admitted will not be Omicron or Corona until and unless a proper investigation is done.
That's why you need to trust your data. The data is transparency and openness the correct data is extremely important as to empower us or to make sense of this current world that we are living in.
So data transparency and the proper data is what she says the need of the hour. And I'm showing you, as you rightly said, this from Auckland. Sorry, this is from Germany. People in thousands are protesting. Such a huge demonstration in Germany. They said enough is enough now. They're all on the roads, thousands, in thousands. No other media shows you all these visuals. It's a huge rally. Your comments on this, madam? You think people are fed up now with all this?
You see, again, we need to be open and we need to explain the value of vaccines to the people. I've always said that you cannot vaccinate yourself out of a pandemic. You'll have to use your vaccines to protect you against severe disease. You have to wear your mask, the simple measurements. So, but it becomes very difficult if there's a new variant 3 or 4 months from now on the market, and everyone again needs to go and get a booster. So, at some stage you will get, and this is unfortunately human behavior, at some stage, after how many boosters are people going to tell you that I'm not interested in boosters anymore? So we need to understand that you need to be vaccinated, but we will never be able to vaccinate ourselves out of this pandemic.
So we will never be able to vaccinate ourselves out of this pandemic. Something else should be done. Vaccine is not the solution. End solution. That is why people get tired. That's what she says. Transparency is the need of the hour. Data sharing with people is the need of the hour. And how serious you think, madam, without any autopsy reports coming out of any hospital across the globe, how can you rate that this corona or delta or omicron variants are that fatal when you compare it to tuberculosis, malaria, or when we compare South Africa, you have no potable water. All waterborne diseases are many. They are killing people. Malnutrition. They are killing people. Do you think corona or delta or omicron is more serious than these diseases?
So you see what is the beauty? The beauty of this is we keep on saying that you need to have proper sanitation. Proper sanitation is not only for COVID; it's for all the other diseases that's there as well. So, but that's the responsibility of the government to make sure that there is proper sanitation. If we can get that right, we will have less other diseases as well, not only for Omicron or for Corona family. Very important to get the sanitation right and the ventilation. That's also in public buildings, that's the responsibility of the government. So government's got the responsibility to make sure that the average person get a vaccine in his arms. Government has got a responsibility to make sure that there is enough clean water and sanitation and good ventilation. And we will take hands with government to do that. But primarily that's their responsibility. And a lot of other diseases will also be improved if they can get that out, especially waterborne diseases.
Especially waterborne diseases. But don't you think the other diseases are more dangerous and fatal when you compare yourself with this corona?
If you look at child death, then it's extremely important to understand that your coronaviruses are not the major death, cause of death in your children, especially under the age of 5.
Yeah.
That is extremely important to know that their waterborne diseases, airborne diseases are much more of a bigger problem than only your corona family that everyone is panicking about.
Because you are a South chairperson. But here another question. Shahid Jamil, he's a virologist. He says, with mild infection, it will have serious long COVID. Can you explain this pathophysiology, madam? This really beats my intelligence. I'm not able to understand. He says, he's a virologist. With mild infection, it will have serious long COVID. What would be the pathophysiology which he is trying to address to? Because that is how signs and symptoms have to be exhibited, right?
Yeah. So I think if you look at I don't know the real pathophysiology behind this, but what I do know is that what I clinically can see, and that should be the normal physiology of the body, is if you look at the disease, especially in the mild disease, it's about, it depends on how good your immune system is, but between 3 and 5 days, most of the body's response against COVID-19 or Omicron has kicked in, and the body itself actually quite well tried to heal itself. I think we sometimes forget that we have a good immune system, and we sometimes just need also to give our immune system some time to kick in, to understand the viral infections, especially if you have been vaccinated and that memory cells kicks in, or if you had a previous infection, and again the memory cells comes into play. And I think a lot of the pathophysiology would lie on your immune system and how good your cells are, your antibodies, as well as your memory in your T cells. For me, that is extremely important. And if you can your body itself can figure it out, which I think it can, we don't always believe our bodies that well, then, and you are responsible as a responsible person, and you watch what you eat, you watch what you do, you watch where you stay. But unfortunately, again, not everyone's got that luxury. That brings us back to the question where you ask about other waterborne and other diseases that's actually much more scarier, but there's not a lot that's being said about them. And a lot is being said about Omicron and Delta and on those variants.
Yeah, but when in that case, now already we are 2 years into this. There is no proper pathophysiology. There is no proper data, postmortem or autopsy reports across, stating that corona is really a killer disease. As you rightly said in the opening remarks, without knowing your enemy, don't you think like fighting the enemy in blind?
Yeah. So it's we know there's a lot of inflammation, but now if you look at Omicron, the inflammatory process is much less. For me, there's a bigger inflammatory process going on in the muscles of the patients, because if you look at the predominant clinical symptoms that they come with, it's skeletal, it's musculoskeletal, and then with that viral fatigue type of picture, and then only come the upper respiratory tract complaints. So it's not first respiratory tract and then the rest. As in Delta, it's the other way around with Omicron. And I am not aware of data out there for autopsies that's being done. As you correctly said, I'm not aware. Maybe that they should be. And it would be interesting to see those articles.
Yeah, but many have come out stating that they're not that deadly dangerous as being hyped in media, and creating that fear psychosis wherein they are putting all drugs for trial on innocent citizens of the world. And people are dying more because of these drugs rather than the corona or the comorbidities.
It's most probably, but again, we need the data, we need the scientific evidence of, and then I think there's a huge field open there, but everyone is so focused on the sequencing of the virus, which is extremely important. And so focusing on this, the infectivity rate, and so focusing on the hospitals that's going to be overwhelmed, that I think good clinical medicine and pathology, I don't see that much. I'm not sure. I was thinking about this. What did we become? What did we become going forward? What happened to good old medicine? Are we now scientists forgetting that there's a patient, whether the patient is alive or dead? Have we forgotten? Is that forgotten? I don't know. I think we have become a different breed from when I was trained.
From where you was trained, because we are moving away from the science, logic, and evidence. Now we are going into the hand of technicians, RT-PCR, and then jab. As a SAMA chairperson, how do you rate this jab? And for a disease which has the lowest of fatality rates when you compare with the other prevailing diseases in our countries like Africa and India, malnutrition. Through malnutrition, you have tuberculosis, then typhoid through vectors, malaria, and encephalitis, viral encephalitis. Many such are, don't you think, more and more important killer diseases? Then why are we not concentrating on them? Because these are going to kill the young children and youth, these disorders which I have mentioned, unlike corona or COVID-19. Then why is that we are not concentrating on these killer diseases rather than daily you give out statistics only on COVID-19 or corona?
I think we have become. There's two answers to this, in my opinion. One is all of a sudden, if you are a scientist or if you are a politician, it's very close to you that you might get infected with this variant that's out there. While if you are a politician or a very learned professor, it is less certain that you will ever get diarrhea or typhoid because you've got the means and you have the you're in a higher class, so that is not really of any significance to you. But once if it comes very close to home, you change your story.
It changes. So it's all being looked in the political spectrum. Wisdom is not there.
I will be killed. Please don't kill me for this, but
I will
this
not.
is how I see
I not. God bless you. Now, don't you think, as a discoverer of Omicron, now you have created a different opportunity for those commercials to exploit? South Africa limping back, enjoying Christmas and New Year Eve, but the rest of the world, lockdowns, night curfews.
Yes, we saw that. We've stopped the curfews. There's no curfew. There's no restriction of movement. We still say, please wear your masks. It's still compulsory to wear your mask, and the simple things, the social distancing, and we're still trying our desperate to just get a first jab in some of the arms, especially the people that might be more prone to get severe disease with their comorbidities and above a certain age. But again, we have to learn how to live with this virus. We have to learn how to live with the enemy. You need to identify the enemy. Can't go and hide the whole time.
You can't go in, but that's what is happening. See, in India, peculiar situation. Right from our honorable Prime Minister to all political leaders, they address rallies, huge election rallies, lakhs of people participate. All of a sudden in the night curfew. Next day morning they reel out numbers in their states. The Delhi Chief Minister goes to Punjab, he addresses rally and comes here. You find so many 10,000 cases, so many cases. Similarly in Maharashtra, now in down south, the same thing is happening. Politicians happily go around when they meet people, when they address election rallies, no corona. As soon as they come back in the night, it is corona. After elections, it is corona. How do you look at this scenario? Because you are a chairperson of SAMA, not just the discoverer. Is it science?
So that, no, that's not science. That is, that is what you do if you want to promote yourself, and if you want to get people to vote for you. So that's how you do it. That's why I said you need to get politics out of medicine, because from a medical point of view it doesn't make sense, but from a politician kind of view it definitely makes sense.
But it is the politicians who are making decisions. Your Indian Medical Association, it just on and off, it just says get vaccinated, and it vanishes. When people are dying, paying lakhs, they don't come to the rescue. When we ask for science and logic, right from Indian Council of Medical Research, and the same thing is happening in every country, in your country too. So how do you think that this pandemic will really end? What should people do?
Again, I don't think it's going to end that easily. I think we are going to see some variants going around. I think it's going to become endemic. But what do people need to do? They need to understand why they need to wear a mask. They need to understand that if I wear a mask and I'm infected, and they need to understand that with any viral infection, 2 days or 3 days before you are starting with symptoms, up until about 2 days after you start with symptoms, you are highly infectious. So therefore, you never know what you have. Therefore, you wear your mask. Your mask is to protect the people close to you or around you. Your mask is to show I care for myself, but I care for you as well. And if we can wear the masks, the droplet spreading of the viral infection will become less and less, because it's difficult for especially the corona family, to get through a normal, proper mask. So if we can keep on staying 1.5 meters away, good ventilation to get rid of the viral infection, it means that the virus have difficulties in finding another human warm body. The virus only wants a warm body. The virus doesn't care whether you are coming from India, South Africa, Britain, whether you're rich, whether you're poor. It doesn't care. Only wants a warm body. And you have to stop that spreading of the warm body. You also need, again, that sanitation plays a huge role. You cannot expect people to clean their masks or wash their masks, wash their hands, if there's no running water and there's no proper sanitation. Cannot expect that. Should not only be for corona, it should be for all diseases. And a lot of the diseases that we are seeing, especially under children, are because of poor infrastructure that's not reaching the poor of the poorest. It reaches people who can pay for it. That's the inequity of these unfortunate problems that are going around in the world. And then we only need to focus on COVID, because if we focus on COVID, then we don't need to focus on anything else. And anything else is secondary to COVID. And that is serious brain, the Afrikaans word is brainspoel, serious, been working with your brain in a negative way. We should be asking the difficult questions. And yes, you cannot always be liked if you ask the difficult questions. And you don't ask the difficult questions because you want to be difficult. But it's actually common sense questions that you ask. And we have forgotten the common sense. We are so focusing on the difficult things that in any case only a small minority of the global population understand. We forgot how to speak to the average person out there that works in your garden, that clean the streets, because they are the people that's getting sick. And what do we do for them? If you can't get them better, can't give them good sanitation and water and the right tools to protect themselves and their families, you will never be able to sleep nicely at night. Doesn't matter how many vaccines you put into an arm.
And the other one, from your interesting point, first day they go on testing. Once they arrive here, they test there, and they come here. The South African Navy merchant captain, he landed in Mumbai. Their entire family is in isolation. They are going to sort it trade. They said while coming from there, they tested negative. Same way from London also in Mumbai they landed. They all tested negative. And as soon as you land here, as you rightly said, it will be third day or fourth day. Only then you'll understand. But first day they take the sample, and is it not false positive? Is it not just harassment? This,
So that's the problem with the the test. I'm sitting here with some people also now. They know they need to leave the country, and they had tested positive with symptoms 2 to 3 weeks ago. They still have a positive PCR test. Now, we all know from a clinical perspective, they are healthy. They're not infected anymore. But because of airlines and people blindly believe that the PCR is the gold standard and not understanding how do you need to use it, these people can't leave the country. And because now airline wants to take them because their PCR test is positive. Doesn't matter how many times you tell them, listen, they had COVID 3 weeks ago. This is not live viral particles anymore that you are testing. That's actually dead debris that still test positive. So that's the one thing that I was sitting with. The other thing is, again, you test people. That's why South Africa doesn't want to go this route anymore of track and tracing and testing. Because if you don't have symptoms and you test the patient, and you test the patient 2 days before symptoms is going to develop, you will not get a positive test. So you're fooling yourself into thinking that that patient is negative, but it's highly contagious. But we don't have the tools to pick up already before symptoms start to identify those patients. And that's a huge problem, So for us, we are very clear. You only test if you have symptoms. If you don't have symptoms, please don't come and waste my time and test. Because what am I going to do if it's negative? You can still become positive 2 days later. So I will then need to say to you, if anything changes, if you start to develop the symptoms, 3 days from now on, repeat the test. So if you look at the cost perspective, and then that patient goes out and think he's fine, doesn't have any viral infection, and just go and spread it because I have just said to him he's negative. But meantime, he's highly contagious because I cannot pick up the virus at that stage. So the best thing is to wear your mask. If you need to travel to other countries, make sure that the aircon, make sure that all of the simple measurements are put in place. And if people go to another country and they're there and they develop symptoms, only then do you test, and then you can alert the other people that was in the vicinity of that person, less than 1.5 meters. If you've been able to manage where if you can identify them, then alert them of what they need to look out for. But a blanket PCR, a blanket rapid test, it's not going to help you.
it's not going to help you. It can pick up dead particles, and they will test positive and highly contagious. If you just test them on the first day, they will become negative. So it's not golden thumb rule that RT-PCR or rapid is the yardstick. So India airlines should not be indulging in that, even governments, because you are in a respectable position in South Africa. Don't you think your body, your organization can influence such? You can tell your airlines, your government, not harass people this way. This is not science. And you do that. Otherwise, they have to ventilate the aeroplane. If that is the case, there should be a physical distance, and aeroplane flying anyhow closed, air conditioned are the most dangerous things. Am I right? For Omicron, if you have ventilation, you will not
Yeah.
suffocate. So the airplanes, they should be flying, not flying. They should be going through the roads, not air, keeping all the windows, everything
Yeah.
open. If that is the case, airlines should not fly at all. But if they are flying, they should not harass passengers. Am I right,
Yeah.
madam?
So, so the air, the filter systems inside the aeroplanes are once they are switched on, meaning that the engine is switched on. They come into play, and they would circulate. That they are there's certain filters that are used in aeroplanes, so that's fine. But the problem is, you need then to have your plane when the people come into the physical into the aeroplane itself. By that time, the engines must be working already to get the filters going. So you cannot wait for all the passengers to be seated, then switch on the engines, and then want the air cons to start to work. Because there's that golden law. So while you're waiting for that, and there's no air circulation inside the flight, the airplane itself, you can spread. But the moment that the engines are working and the air cons are working, and the air cons is related to switching on of the airplane, as far as I understand. I might be wrong. But then it's fine. So while you wait for people to get off the flight, to disembark, you'll have to keep on
Yep.
keep the engines running.
Running. Engine should be
Otherwise,
running. Air circulation.
Very-
The same thing happens with the ICUs, intensive care units too, because all those vents, they are the breeding grounds for virus or bacteria for whatever variety you call cocktail. Don't you think they'll be breathing more there? Same thing applies to ICUs. It's like a aeroplane waiting for a disaster. Don't you think so?
Yeah, a lot of the hospitals are not equipped, especially the older hospitals, are not equipped with good ventilation. It's not. So, there's no windows that can open in a lot of hospitals. The rooms are small. ICU should have negative pressure as well. But we're not really equipped for this. And I think it's globally. It's not only South Africa.
Yeah, not only South Africa, not only India, globally. Last two questions before we say bye. Mass vaccination and asking people to wear masks. Don't you think nostrils God has given us to breathe air, not oxygen? We breathe air. Through air, we pick up oxygen. But when you are masking the entire people, don't you think there is a lurking danger? Because Bangladesh studies have clearly exposed mask 85%, it's not going to do anything. And those surgical masks, how to wear them, how to discard. And common man cannot afford. And surgical masks, only theater they wear. The surgeons they wear to see that nothing is transmitted when the body is open. But why are you doing it outside? And that too with all healthy people, and that too especially children. When you are making children to wear masks right from morning till evening in the schools, how dangerous it is. Lack of oxygen. Don't you think they will land into hypoxial states that will lead to severe psychiatric as well as other disorders to confront with?
I don't really think so, because you know what? Children's got this way of taking the mask off. They play. They're not sitting correctly. They're not fitting properly. So even the mask, if it's not fitting properly, you can still spread the virus. But at least you will spread it less than you would have spread if there was nothing in front of you. I think it's difficult if you exercise. with exercising and running and that type of thing, you will have to wear the right mask to help you to breathe properly. But there was studies done that said it's not really influencing the oxygen levels.
They
But
landed
again,
mostly landed into hypoxial states. The studies clearly tell they landed into hypoxial, and the dampness has led to fungal infections. And in children, that spit unnecessarily they will swallow the same, and you are making them to breathe the same because God has given you this air to breathe from, and then you let take whatever oxygen you need. The body has got that. Instead, you go to hospital and they oxygenate you. That is a different. That is dangerous. Then, but you are making. See, those vulnerable, it is fine. You are mask them, but healthy people to be masked as if it is a mandate. Don't you think it is risking their lives? And children, psychiatric problems will land. And similarly, mass vaccination. Why do you need a mass vaccination of an under testing, under trial vaccine which doesn't have liability and compensation? Even today, every country is using it under emergency use authorization. Now, where is the emergency in South Africa? Likewise, we ask in India, did you do any serological study to understand the antibody levels, to understand the infection prevalence levels? Only then you need to have another measure. And now, last these two along with that, what is the definition of vaccine? Is it to stop transmission, or you say no, reduce hospitalization, reduce this and that? Does that imply for a vaccine? Is it not being used like a drug now? Don't you think it is a deadly dangerous thing, booster after booster?
well, that's why I'm saying I think we're going to lose the average public out there when it comes to their fourth booster. I think by that stage you will get the wise people just sitting and watching this and saying, it's not for me. I've not been boosted more than enough. But again, it depends. It all depends on what's going to happen going forward. But we need to use common sense and logic as well. And good old clinical medicine. We forget about that. We keep on forget about it.
Yeah, but don't you think that our natural immunity, our eating habits, our own thing, as you said, memory cells, don't you think they will be much better? Or else in India we have alternate Ayurveda, Anandaya's Ayurveda medicine is there, natural therapy is there, so many other systems of medicine. Don't you think why World Health Organization or a country like Africa and India with such huge population, similar tropical climates, why not we try something different rather than using these chemicals? They are under trial, still being used under emergency use authorization, investing public money. And again, believe me, without liability and compensation, 2 years close, how do you say that they are not liable, they should not be compensated? That means they are not sure. When you are not per sure, how can you use them on lives, madam? You are dealing with lives, not machines. Don't you think alternate methods should be searched? And don't you think? And the last,
There must be studies. Yes, I agree with you. It's always about the studies and to show that this can work.
if this is not working, alternate methods, don't you think we should employ?
Yeah, you need to, but again, we saw what happened with ivermectin. There was a lot of people swearing that ivermectin is working, and I think it's very important that we also understand that once, I don't think there's good trials on Omicron and other alternative medicine, but I think we need to look at those fields. We cannot just say, there's no value in any alternative medicine. And if we can, one can, have a proper study and showing the value of this, it would be very hard to dispute it.
Very hard to do. And what is that as a discoverer of Omicron symptoms? Do you think, is it a boon or bane for Africa and for the world? The way people are being feared into submission again, lockdowns, curfews, booster after booster. Omicron, you are now, it has become endemic, you are happy because it has become like a natural booster in Africa. Am I right, madam? Cases have come down, no more fatalities.
Yeah. Yes, there's still a lot of people that there's still fatalities in Africa, and there's still positivity rates. But I think again, anything that can work, that's proven that can work, one should try and see how good it works. And again, being open and transparent about what one do and with your results and peer review your stuff so that everyone in the end of the day can benefit from whatever is out on the market that's really working, because there is not really good stuff out there that's working.
But now you can clearly tell the world that Omicron, South Africa has learned to be living with Omicron, and you are the same message you want to convey. As you rightly said, Europe, once Omicron takes over, Europe also will recover.
Off on your back now. Sorry. Can I just, I need to go on another meeting.
Yeah.
Good
Yeah.
phoning me.
Yeah.
So I just think it is very, very important for us not to panic. I think it's important for us to understand the basics. Not us, everyone. And I think it's important to, if there's other alternative medicine out there that's got, proven results, I think we should use it and empower people. I also don't think that vaccines, that the injectable form going forward is really the answer, especially in your poorer countries, because of the huge logistical problem around the refrigeration of these vaccines. It's time to start looking at maybe tablet forms. I've said this before. And I think it's time that the richer countries with all their boosters that they are administrating, that for each booster that they administer, that they donate another booster or another vaccine to the poorer countries, whether it's something that you can use for Omicron or for your Delta viruses or for your whatever variant, or whether it is something that you can do to improve the life of the poorer countries, especially around sanitation. I think there's a social responsibility as well to make sure that everyone is or that no one is left behind, regardless what method we are using, whether it's a vaccine or whether it's another form. But something needs to be, you cannot just, again, vaccinate yourself out of a pandemic.
Thank you, madam, because you are to attend another meeting. I've taken a good time. You cannot vaccinate yourself out of pandemic. Alternate methods should be searched. People should be informed, truly informed of science, logic, so that they can take a decision and make them responsible, so that they will learn to live. So they will not infect themselves, not their family, society, as well as the province or state or country. So like that, everyone should be well informed, and just vaccination is not going to help anymore. Omicron has come to a base level in Africa. They are learning to live with that. Big 600 hospitals in just 8,000 cases, and that also she is very candid enough. How many are of really Omicron only? Granular studies. Further investigations only will be able to and make them clearly to come to understanding that it is Omicron death. So until and unless you do that postmortem or autopsy, you are not going to get any result. That is not science as being forced upon in India, in every state. The politicians, administrators and their media trying to create a fear psychosis. At least hope with this show better sense will prevail, wherein they will try to educate people out of this pandemic, making them to understand what are the clear symptoms and signs of this Omicron, and how we should live with this Omicron, which is not, as she claims, not that deadly dangerous like Delta, whether it is fatality or hospital admissions. No more hospital admissions, very low level in Africa. Mind you, those admissions, you cannot attribute them to be because of Omicron, as she very candidly explains. The same thing should happen in India. Just churning out RT-PCR also, she was very clear. It is not a golden thumb rule. Dead particles also will test positive, and those highly contagious, if you test on first day, second day, they will go untraceable because they come negative. So RT-PCR or rapid are not a golden thumb rule. So why are you insisting then? With no symptoms, if asymptomatic, why do you test? Why do you quarantine them? This is a waste of resources, because it is public money which you can use for more killer diseases like tuberculosis, malaria, diarrhea, typhoid, and all those waterborne diseases, whether it is Africa or India, where poor people suffer with that, and deadly diseases like tuberculosis and malaria. Even World Health Organization itself accepted because of corona. They went undetected. Believe me, if they went undetected with 100 years old BCG vaccine, even after treatment with drug resistance, out of 120 are dying. Which is dangerous now? Is it corona or tuberculosis or malaria? Similar lines. So people have to understand, become educated, well informed. This show is also with full of evidences, science and logic, so that you will start questioning the government, administrator and the media when they churn out these figures. Ask them with these true figures which he has presented, what is happening in Africa, the birthplace of Omicron. Then they will not do this, so that you don't panic, you don't get into fear psychosis, and don't unnecessarily rush to hospitals, flood hospitals, because there are many people with serious illnesses, right from cancer to tuberculosis, who needs hospitalization. So spare them. Until and unless you have something, don't even go for testing, but maintain that vigil, your own responsibility to see that how you overcome at your house, home front as well as official front. And children also, then they are part and parcel of the same family. Don't you think natural immunity has come to them? They have got thymus cells, there are no ACE receptors in their lungs. Then how is that they are going to be get infected, and why should they be vaccinated? That is a $1 million question. She clearly stated, you cannot vaccinate yourself out of this pandemic. Even alternate method should be taken care of. Tomorrow on Citizens Dr. TSPR channel, you have a retelecast at 8 p.m. Support Dr. TSPR channels. It is in larger public interest. Thanks a lot. Take care, madam. God bless you. We will soon see you with another mode of live show with so many important things coming out of South Africa and the world. Take care, madam. We wish you the best for African people. You are enjoying birthplace of Africa, but India and the world, in the name of Omicron, so much of fear is being created, so much of commercial viabilities for pharmacies, insurance companies, and blah blah blah. God only help. So for Indians, Sukhanidra, Shubharatri. For the world over, good morning, good afternoon, and good night. Take care. Thank you, madam. Bye.